Welcome everyone. Good evening, everyone. Thank you so much for joining us. Those who did last time and really enjoyed it, thank you so much for joining us again. And those who have come in for the first time, Dr. Yogesh is going to brief you a little bit about what we spoke about last time and what compassion fatigue is. And last week was more on what compassion fatigue is, and today it's going to be about how not only can you recognize it, but using a simple self-aid tool that Dr. Yogesh would share, we can actually help ourselves overcome it in whatever capacity. And a little bit about myself and why I'm doing this. So I'm a psychotherapist. I've been a practicing therapist for almost a decade now. And it was not just that I wanted to join the bandwagon of doing online stuff, but I wanted it to be very, very real. I wanted it to be authentic. I wanted to not just bring experts, but I really wanted to kind of bring forth real life stories. And I just started this. Um, Thanks to Dr. Yogesh, episode 1 has received the highest views on YouTube from all the kind of episodes that I've done till now. And Dr. Yogesh has been a mentor for me for the past few years, and I think he really helped me change my life in ways I cannot explain. So over to you, Dr. Yogesh. Please introduce yourself as well. I would, because you do it the best. Um, Over to you.
Ishita raises the expectations so high, So, any which ways, guys, last time what we did is good to recapitulate that quickly and then move on. I'm sure those who have not been there last time, you must have seen the video link. Ishita was so kind to quickly upload it on the YouTube. So, it will give you an idea. That was more about understanding what is compassion fatigue syndrome, which so many of medical, paramedical, people who are in the frontline COVID, people who are in the caregiving professions, people working at the hospice, the therapists, the psychologists, the people who are actively dealing, the nurses, the ward boys, people who are directly dealing with the patients all the time, they go through. But then it's not limited to them. As I said last time, it's not even limited only to human beings. Compassion fatigue is even seen in animals. You'll be surprised. You'll be surprised. Those who have pets will know about it, but it's beyond the purview of this talk. I don't want to go there because I had the good fortune in the last 30 years being a homeopath myself to treat a lot of pets, horses, monkeys, parrots, dogs, of course, they are there, and I came to know lots about pets as well, and they amazingly respond to homeopathic medicine. It's surprising. We treat them just like human beings, and they suffer from many of the signs and symptoms what their masters have. Surprisingly, in fact, the masters start looking like the pet after a few years because they are so much in bonding and love. It's like husband and wife or two lovers. After many years of intense attachment, they start looking like brother and sister, and that is not a joke. Try it. Look at some people who are really connected to each other. They start looking like each other. A person who has a cat and very connected to the cat starts looking catty. A person who has a dog suddenly starts looking like that. And we have noticed this, and try to observe. It's good fun to observe people. Study a science called as physiognomy. So compassion fatigue syndrome is now seen more because of the corona, because everybody is, if you see, on the streets trying to help everybody. And last time as we spoke, I gave you all the example, first day when you saw the news, second day when you saw the news, what happened? Your heart went out to all these things, the people dying and how many people are falling sick. Oh, the workers who are moving out back to their villages, they don't have slippers, and you felt bad. But after some time, suddenly that news stops bothering you. Yes, you feel bad. You actually don't want to even watch the news. What is happening here? So you start noticing that. And also compassion fatigue, last time we tried to differentiate it from the normal apathy. And then what is vicarious trauma, how it goes into vicarious trauma, how excessive caring, very important word is excessive caring for a prolonged period of time. The word prolonged is very important. When for prolonged period of time you're taking care of somebody who's sick, who's dying, who's traumatized. So it is actually trauma of others which is bothering me, where I needed to be caring for them. And that's why other name for compassion fatigue is cost of caring. And caring, we do it is for others. And that's how it gets differentiated. Since this is a medical paramedical group and psychologists here, you will understand that's how you differentiate it from post-traumatic stress disorder. In PTSD, post-traumatic stress disorder, the trauma is on me. I go through the trauma. In compassion fatigue, you see the trauma of others and you pay the cost of caring. You pay the cost of being sometimes a therapist or a sensitive individual who opens your heart up to them. And then you are so giving, that in the end, you have got nothing left even for yourself. And slowly you go into vicarious trauma, and there is a physical erosion, there is an emotional erosion, there is a spiritual erosion. And the very core value systems of yours get eroded. And once that happens, you don't know what to do, because then you become kind of indifferent, you become apathetic. And then we went through the signs and symptoms of compassion fatigue syndrome, which could be as little as lack of focus, concentration nahi ho raha hai, or intrusive thoughts. I don't want to think, but the thoughts are coming back. Small thing somebody says, I brood over it. And then a variety of psychological disorders. You can go up till suicide. So it's like pretty much a huge spectrum. And then, of course, we try to differentiate it from many other things. We're not going into it. You can see the video again. I just kind of wanted to jog your memory so you connect to the previous session. And I did touch upon how do you treat these people. First is identification. So I gave the example last time also, when respiratory system is affected, signs and symptoms are going to be same. There will be breathlessness, there will be cough, there will be chest pain. Now, same is true for cancer of the chest inside in the lung. Same is true for asthma, same is true for bronchitis, same is true for corona also, corona pneumonia. So signs and symptoms will be lack of concentration, but the cause which is causing, the evolutionary history will tell you what is the exact diagnosis. And once you know that, you can help the recurrence. So diagnosis is very important. Ideally, this should be treated by a qualified person who knows about compassion fatigue syndrome. But if that is not possible, what do you do as first aid till you reach that person is what we are going to do today. And in almost 80 to 90% of the time, you'll be able to help yourself and keep yourself stable till you reach proper professional help. Or if you get into awareness, you'll be able to help yourself too. But this is not to replace professional care. Is that okay? I think, is that good to understand that this will not be a replacement to active professional psychological help? This is not a substitute for that. I'm just going to teach you a technique, a process. There are many processes available, but I find is very deep, very simple, which will maintain your balance, where you will be able to hold your space and then actively go on looking for help or do what is required to be done. So with this, let's quickly touch upon what we said last time. What is actually the treatment? The first treatment is not to blame the person. I'll tell you, I'm treating a homeopathic doctor. She went to the clinic in the entire lockdown. She's actually working another senior physician's office. 85 patients a day, she says. We see 80 to 85 patients every day. So many of them are corona positive. So many are suspect positive. So many we don't even know because they don't want to test. So I'm seeing, and sir, now I've got symptoms and they are all of corona. I'm getting chest pain. I'm breathless. I'm having fever since last 2 days. My teacher is telling me to take antibiotics, but no, I want to take homeopathy only. Why I'm telling you this is because I asked her, what is it that why are you trying to take homeopathic treatment and not going to the active fever clinic? No, sir, they will admit me there. Then I will not be able to go to work. Do you see that desire to serve is so strong? It is not the money that is mattering here. And then I told her, okay, tell me, the moment you came to know that you have all these corona symptoms and your teacher told you, the famous doctor, he's a famous South Mumbai doctor, he told me this is clinically 100% corona, dear. He has 6 assistants. This is 100% corona. If you go for testing, they'll admit you. You'll go into emergency quarantine. You self-quarantine yourself. But she had active symptoms in the sense she was feeling collapsed. There's no strength. It's all bad symptoms that she has. Very typical of, the COVID-19 disease. Corona is the name of the virus, right? So I asked her, the moment you came to know when your teacher said, I think this is clinically confirmed corona positive, what happened? You know what she told me? Take a guess. Come on, let's unmute yourself. Who's going to tell me that? What could be the first symptom? And it's okay to be wrong, okay? Can we just have like an ex-tempo chat? Yeah?
Yes.
Chalo, who's going to say? You can unmute yourself, say it, and then mute again so that the voice quality will remain clear. Yeah, Geeta, you want to say? Komal, you want to say? Pearl? Anybody else? What could be the first response? Imagine yourself in her shoes.
I think she was more relaxed.
No, the moment she came to know I have corona, was she more relaxed? That's what I'm asking. The question is, the moment she realized when the teacher said, I think this is 100% pakka clinically corona, you test it, it will come positive.
Oh, that's what I thought she must be saying.
Oh, that's what I thought. Good. That is one response. Anybody else who has any other response?
Now I won't be able to talk, people.
Like,
Now I will not be able to help people. Okay, fine. So whenever you're saying the answer, just say your name so we come to know, okay, who's saying that.
Shreya.
Yeah? Shreya. Okay, thank you, Shreya. Who
Okay,
else?
so Shita here, I think she could probably say, oh my God, how being a doctor, how can I have it?
Superb. Very nice. That's a good one too, Ishita. Okay, who else? Shruti. Come on. Puneri Bai.
she
मी
must
सांगितलं. No, the
Ah.
first
Yeah,
one is what
Shruti.
I said.
Okay,
I said the
you had
first
said?
one.
Okay.
Yeah, the first one. I said, okay, so I finally got it.
Okay,
That's
fine.
what-
Shalini, Divya, who else? Anybody wants to comment?
She
Come on,
must
one or
have-
two more. Mansi.
she must have thought that I have a lot of responsibilities over me, which I need to still go ahead and complete.
Okay. Okay. Yes, Komal, that's a good response too. Yes.
Hello.
So you are a
Hello.
very responsible person.
She could have thought
Okay.
about her patients. She would have
Hello.
She could have thought about her patients. Yes, that's right.
Hello.
Yes, hello. Tell me.
Hello. She will see that I will miss my patients. I will not able to
Correct.
serve
Correct.
them.
Correct.
I am
Correct.
needed for them badly.
Very true. Very true. Very true. I'm needed by them. Yeah, the need to be needed by others. Yes,
Geeta Punjabi.
that's also true. Yeah,
Geeta
Geeta.
Punjabi.
Oh, Geeta Punjabi. Wow. Oh,
How are
what a
you?
senior person is here. Thank you so much, ma'am. She's my
How-
teacher. She's here. It's
How are
really
you?
an honor to have you here.
I'm
Thank you
happy
so
to see
much.
you.
Okay,
Happy
but
to
we
see
can't see
you.
you. I want to see you. Where are you? Please switch on your camera. So guys, this is one of the senior most homeopaths you have here. My teacher, she's the teacher of teachers. Amazing researcher. She's a researcher, according
Thank
to
you
me.
so much for joining us. It's an
Yes, it's
honor.
really an honor, Dr. Geeta Punjabi, to be here. Really an honor. Okay. Okay, so you're all right what you have said, but this girl said something else. What she said was, oh no, I should have taken care of myself. And this is the first thing that we got to be very careful. The moment a person goes into compassion fatigue, doing so much for others, that, as Dr. Geeta Punjabi says, पूरा कमंडल खाली कर दिया उसने. पूरा कमंडल खाली कर दिया. कुछ बचा ही नहीं, खुद प्यासा रह गया, पानी नहीं है पीने के लिए, सबको दे दिया. Okay, so the whole thing they've given others, there's nothing left. And then once they get afflicted, once they get physically, morally, emotionally afflicted, and they are given a diagnosis of a disease, that's the time they think that, oh my God, I should have taken care of myself. And they go into a self-blame. Why I did not take care of myself? This girl says, all my colleagues said, I asked my colleagues, तुम लोग को कोरोना नहीं हुआ? I have got corona. Now what? How did y'all not get it? Y'all are also working in the clinics. So you know what reply they gave? Oh, we were taking care. We were doing gargling every day. We were drinking warm water. We were taking that adrak wala pani, turmeric wala pani. We were doing all the gharguti ilaj. And I did not do. My mother was also telling me, you do it. I was careless. She went into a self-blame story. So the first part of the treatment of compassion fatigue syndrome is never to blame the client and self. That I did not take care of myself. I was careless. Because the moment you do that, you tell them you did not take care, you did not exercise, you did not take a holiday, you went to work every day, you have no time for yourself. I told you don't take the phone calls after 9 o'clock of your patients. Why you were taking? Why can't you say no? You have not learned to say no. And these people then start going into this self-blame, self-reproach story. And then comes the worst part, guilt, which is a silent killer. The guilt will slowly take them
I want to ask one
deeper
thing.
down. Yeah.
Just a symptom, it could be to such people twitching of this bone and it creates pain all over.
Yeah. So any psychosomatic symptom can be there. So whichever is the biological area of your weakness. Let's say in your family, lots of people have asthma. These people can get triggered into asthma. Let's say in your family, many people get certain allergies. You will get some allergy, or some people get joint pains in the family. It runs, so it will come. So whichever is the biological area of weakness in your family system, that can get triggered. Not necessarily only that, it can be something else. So psychosomatization can occur anywhere in the body. Anywhere.
Is
Okay,
there
the
cure for
idea is
this?
to study it evolutionary from where it started.
But is there cure for all this pain?
See, I think you're asking from a personal idea that you have in your mind. All psychosomatic problems can be cured. The beauty is they are totally reversible. Okay, so it can be. If it is proved to be psychosomatic, there is no organic pathology there. What if it is a neurological tic? That also has a psychosomatic component. When you cover the psychic component of it, automatically the need for medicine or the illness will reduce. Yeah, but this is not to replace medical therapy, whether you're taking allopathy, homeopathy, whatever, doesn't matter. This is not to replace the medical therapy, but it is to help you complement. Last time I think you were not there, Geeta, but or were you there? You
Yeah,
were
I
there.
was there.
Yeah, so this is a complementary. You know what is complementary? So it's like you say I'm wearing a tie today, but that doesn't mean that you're not going to wear a shirt. Shirt is necessary, then you wear a tie on it. You cannot say I'm only going to wear because I've worn tie, so I don't need to wear clothes. So this is complementary. The main thing will be there. This is going to complement it. And maybe if you are lucky, you could do a complete reversal too. So we'll come to it. But the idea is treatment. First thing is never to blame the person that you did not take care. Never to tell the person, see, I was telling you. You are not careful. See, the news people kept on telling you you should take care. You did not do it, etc., etc., etc. Maybe your Guruji told you, maybe your mother told you, maybe your friends told you, maybe your colleagues told you. So many of the people may have told you so many things. So first thing is not to blame. And then, of course, there are other things which I don't want to say because we are going to take a live demo. And I invite Palak. Palak has volunteered to be a demo. But it's very important to understand that when somebody is being a demo here, this recording should not go out anywhere without Palak's permission. One. Secondly, understand that Palak is giving you an opportunity to learn. It's like, you can learn through my experience. So in your mind, just send her good wishes so that she finds a resolution for herself. And that will really add on to her. And also, I believe we all reflect each other. So it is not only Palak's issue, it is everybody's issue. Only Palak has the courage to come forth. And that's the beauty. And of course, you're saving a lot of money. You come to my private, I'll charge you a bomb. So you're getting a free session here. So we're going to have fun because therapy is fun. Therapy is fun because it is all about exploring and knowing yourself. Nothing else. Nothing else. Because a judge who has written an order can cancel that order or change the order only if the judge knows that I have written that order. I cannot cancel some other judge's order. So I have to know that what is happening to me has been sanctioned by me. Once I know that, I can change it. Because I'm the story writer, I will change the story. But first you have to prove it to yourself. You are the story writer and you have written this for yourself. And you will know how this is done. So I'm going to teach you a very simple technique, which you can do anytime. You can teach somebody else also as a first aid before you reach professional help. And sometimes, in many cases actually, this is all what you need to do. You come to the awareness. Okay. So I invite Palak, and before that, Ishita, you want to say something?
So I'm saying this as a psychotherapist myself. Often I've seen this, one of the key signs and symptoms of compassion fatigue is lack of sleep. Insomnia is very, very common because now when we're talking about fatigue, we are talking about fatigue on a physical level as well as a mental level. So whatever is going on in your mind, it is going to reflect in your body. And this is something that I've noticed for compassion fatigue per se as something called compassion fatigue that exists came into light for me about, I think, 2.5 or 3 years ago when I was dealing with it myself. And when I started working with people, this is something that I saw chronically. There was insomnia in, I would say, 90% of the cases. So this is just something that, that I wanted to share.
Very nice. So as I said, as Ishita has rightly pointed out, the symptoms can be from lack of concentration to tiredness. It's like after you wake up in the morning, you're like more tired than you went to sleep. Now, ideally, sleep should be refreshing you. It should be refueling you. So if you're feeling tired, there's definitely something wrong. But it's still initial. We tend to ignore it because these symptoms can be very easily diverted, etc., etc. You do so many other things, no? People start taking Chyawanprash, not realizing that you need real sleep. Chyawanprash will do what to you? Or you take a sleeping tablet and you get an unnatural sleep, which is unrefreshing at times. But anyway, symptoms are lots, which we have spoken last time. You can just Google it. The entire psychological diagnosis can come under this. These are huge disorders. These are a spectrum of disorders. We just call it for the ease compassion fatigue syndrome. So, Palak, so let's begin. So guys, I would ask all of you to see to it that your microphones are on mute, yeah, so that you can hear us well. So Palak, can you tell us why do you think you have compassion fatigue syndrome in short?
I think it's because when I was rewatching the video of the first episode, and 2 minutes within the video, I knew that I had compassion fatigue because I could connect to a lot of things. In fact, most of what you were saying. And along with that, I found myself feeling extreme discomfort while listening to it because there was a lot of resistance in accepting that this is something that is like one of the major reasons, things that it's a giveaway for me. If I'm feeling resistance towards something, I know that this is something that I am going through and not dealing with. So, which is why I feel the symptoms mentioned, the things that you talked about, including insomnia, I find myself dealing with it quite often. And
so can you tell me where you felt it is compassion fatigue for you? Where have you been given compassion? So guys, for all of you, Palak is a psychologist herself who's practicing and who started a foundation recently. So she's not a lay person. She knows what she's talking about here. Okay. So when she's talking about when I find resistance, I know something, I surely know that she's a very aware person. Okay. So keep that in mind, that she is a practicing psychologist and she's saying I have compassion fatigue. So it's kind of diagnosed. But Palak, just for others who are not psychologists here, why would you say you have compassion fatigue? Where have you had prolonged caring that you have done? That is very important for us to know.
First of all,
of course, if it is not too personal, if things are very personal, please hold it back. It's all right. I can understand. But you know what? Is hamam mein sab nange hai. So don't worry.
thank you for the strokes, first of all. And I
You
wanted
know
to
what is strokes? What she's talking? Sorry to interrupt you. So, you know, these girls, Ishita, Palak,
Palak
these
as
people
well.
really learn a lot of new
Palak,
things. So
yeah.
they have learned, I think, transactional
Yes, yes,
analysis. So in that they use the word stroke. So
yes.
whenever you praise somebody, it's like somebody gave me a positive stroke. Whenever somebody put you down, it is like negative stroke. Like I gave a positive stroke to Dr. Geeta Punjabi. You know, I told her, oh, my teacher. And the moment I said Kamandal, you should have seen her mouth open. Oh, wow, he remembers. I told her so many years back. See, now she's smiling. Okay, fine. So, so there's a positive stroke. Okay, so like you get up in the morning and you see a nice scenery outside. Nature is giving you a positive stroke. Okay, something like that. So if Komal is doing Haspadasana, and in the first shot, if she's able to touch the ground, wow, my body is so good. So she's giving a positive stroke to herself. Okay. So yeah, Palak, sorry.
uh,
Yogesh,
Ji.
what I am saying, that is it not right? हर एक अपना कचरे का करवंडल लेके आता है. We have to
True.
empty that.
Yes, you're right. वो empty करना है, बराबर है. वही तो हम बोल रहे हैं. मगर क्या है, कोई कोई लोग compassion fatigue में वो कमंडल में दूसरे का कचरा भरते जाते हैं. वो प्रॉब्लम होता है. उसको हम बोलते हैं इमोशनल गार्बेज बिन बनना. जो लोग ना नहीं बोल पाते हैं ना, वो क्या होता है, वो दूसरों के लिए इमोशनल कचरे का डब्बा बन जाते हैं. जैसे बेचारे साइकोलॉजिस्ट होते हैं, बट ऑफ कोर्स ये पेड कचरे का डब्बा होता है. आप 1 घंटा मुझे इतना पैसा दो, आपका सब कचरा यहाँ डाल के जाओ. बट बहुत सारे लोग होते हैं जो विदाउट चार्जिंग कचरे का डब्बा बन जाते हैं, और वो फ्रेंड्स लोग उनको ही आके सुनाते हैं अपने प्रॉब्लम है. आई नीडेड समबडी टू हियर मी, कैन आई प्लीज टेल यू समथिंग, and you don't say no, and they keep putting it. And you see the housewives maximum, they hear the kids, they hear the mother-in-law, father-in-law, husband, kamalibai, everybody, they're hearing everybody else. So that's another thing,
It's
teachers
a
and so many other things. Yeah,
it's a
yeah,
basically learned behavior.
true,
How
Geeta.
how can you unlearn this?
Yeah, that's what we are doing. That's what we are doing, Geeta. You're right. Yeah, I know. You know what happens? Then you're bubbling because once you have diagnosed it, you want to now get rid of it. Jaldi, abhi, jaldi nikal jayego. Wait, it's a process. You have learned it over this learned phenomena over not only years, not only generations, it goes across family systems. And that's why you have transgenerational learnings which percolate, which need to be broken, and they can be broken. So Palak, now no more questions. We focus completely on Palak and no more distractions and diversion. Otherwise, Ishita will get very angry. Okay, Palak.
so I would like, I'll try to keep it as brief as possible.
No, please be vociferous. Please be profuse. Please spill out the beans. Tell us how you know this is compassion fatigue, where you had prolonged compassion. Tell me that.
Or first of all, like what you mentioned about it being a process, which is another reason that I would like to go back and start it from last year. There was a time when I would find myself being available for anyone and everyone who needed me, and found it extremely difficult to just say no to anyone. So that's where it started. That's where I knew that I told myself it's because I feel I'm compassionate. You know, I don't want the other person. I have been in that place, so I don't want the other person going through the same thing. At least I want to be there for the other person while they go through it. That's how it started. But slowly I started being compassionate towards myself, and that helped created a difference in the way I was with when I was compassionate to others as well. So in that sense, I have worked on this journey when, you know, that the guilt and the way the things that I felt uh, found myself lacking behind in my life because I couldn't be there for other people. From there to reach here was itself in itself like a big space. But again, even after coming from there to here, even though it's not in that extreme level, at the same time, I find myself going through compassion fatigue in a completely different manner. So it's like, I find that not perhaps for everyone anymore, but a lot of people still, a lot of cases still. Like there are certain situations and people with whom I just find myself feeling the same things as I did back then and not being able to draw that boundary. It's very blurred in the sense of putting myself first and realizing that I cannot be there for someone else when I am not okay myself. But that line, that boundary is very blurred when it comes to a lot of people. Perhaps if it's situations and cases that I personally feel myself very sensitive to, come in my personal life.
And
So,
that makes you feel what, Palak?
I can feel anxiety. I think that would be one thing. And extreme compassion, to the point that I would feel that I have to be there for the other person, even if
Okay, give one example without taking names.
Okay. It has to be a professional, from the professional sector, or a personal.
Any. Compassion wherever prolonged caring was there and that caused some problem to you. That's it. We want to just establish that fact.
Right. So, for example, right now there's this person with whom I feel this on a very deeper level, because I feel like whatever things I am going through, the person has gone through those same things, all the same issues, the pain, on a much more intense level, and wherein I was able to somehow stop myself and reflect. That person did not get the opportunity, the circumstances, the environment to do the same thing, and went way over the edge. So there are many a times, and in fact almost every day, I find myself in situations where I find myself pushing way further towards to make sure that this person is okay when I myself need the space.
Okay. So now if you have to put the whole of this problem in one line, how will you do it?
Can I get a minute to answer that?
Of course. So while you're thinking, so guys, see, when we have issues, we kind of go round and round like a jalebi in it. Did you see what was happening to Palak? Palak, you don't hear us, please. You just take your minute to come and describe your, and since she's a psychologist, she knows too much about mind and working and processes. So her mind will quickly go to diagnosis. I think I have anxiety, I have this. But an ordinary person does not do that. You do not diagnose your own self. She's aware, so she's able to do it. So she's going round and round and round and round and round. But the idea is to catch the essence of the issue. And whenever you feel you have lots of problems and don't know what to work on, I have so many problems, I think I'm a gone case, I'm hopeless. Yeah. How can I go to a psychologist? They will laugh at me. How many problems I have? Sometimes you go through this feeling. So Palak is laughing. Okay. So the best thing you got to do this is ask yourself, how can I explain my entire problem in one line? That will prioritize your problem. We need to prioritize the problem. So yes, Palak, are you ready? Your 1 minute is done.
Yeah. I see myself in that person and I feel guilty.
No, in one line, what is your problem?
What is my problem?
Yeah. Because you're still explaining.
I don't know where to draw the line.
Excellent. Now you see the whole story is cut short. Now you won't get lost. So beautifully. Now, whatever she has said, if you see, the essence of that would be, I don't know where to draw a line. What she's talking about is boundaries, which is such an essential thing in life, such an essential thing. The very fact that we are spiritual beings who are here on earth going through the physical experience, this body is a boundary. It's a line. Beyond this line is me. It's a boundary. We have come here to learn about boundaries, about self and boundaries of others. Respecting our boundaries and respecting. So I don't know how to draw a line, right? Correct? So we'll now stick to this. So all of you who have this compassion fatigue here, in case you have felt that anywhere else or any other problem for that matter, just think of it. If I have to describe my problem in one line, what would that be? So you all can simultaneously do that too. I will work with Palak. So Palak, I'm not able to draw a line. When you say this, what does it make you feel? Yeah, tell me.
One thing I would want to clarify, that it's not that I don't know how to draw a line, because I have been drawing lines for past 1 year, and the work on boundaries is something I've been doing for a while. What I mean is, in certain situations, I still don't know where to draw a line. This is one of those situations. I don't know what the boundary should be. So it's not,
Okay.
I don't know where to draw the line.
I don't know where to draw the line. Okay, it's not that I don't know how to draw a line. I don't know where to draw a line. You see, truly a psychologist speaking, there how they play with words. So that's nice. It's the beauty of being a psychologist. Okay, so I don't know how to draw a line. So tell me, what needs to happen in Palak's life so that she knows how to draw a line?
Not how to, where to.
Or where to? Yeah. So what needs to happen in Palak's life so that she knows where to draw a line?
She needs to be aware of her priorities.
No, wait. We'll just wait. Give her that
Oh,
time.
sorry.
So am I supposed to answer that?
Yeah.
I thought you were asking everyone.
No, Palak. So what needs to happen in Palak so that she knows where to draw a line?
Maybe I need to decide. I mean, it's actually more of a moral call for me to know where I want to draw a line. And
Okay.
I think those lines are also blurred because the compassion fatigue, that factor in me, hasn't completely gone away. So once I start working on it, I would have not a clearer thing in mind, but clearer space to be able to decide on those models without having any emotions associated to
Okay,
it.
so which are the moral things that are coming into play here? Which if they were not there, you will be able to know where to draw the line.
So, for example, this person that I'm talking about is a family member, a very close family member. So,
Let's not go into personalities, not required. We don't need the story.
can you repeat the question then, sir?
Okay. So which moral thing that you're talking about or value system here is coming in the way, which if it was not there, Palak would know where to draw the line?
I am responsible in a way, I am somewhere responsible to be there for this person and take care of that person, which is a very messed up belief system.
No, it's okay. I don't want the story only because that will confuse all of us. Okay. So somewhere I am responsible for that person. That's it. Yeah. So we have developed three things. One is you have compassion fatigue because of excessive caring, because you don't know where to draw the line. Why you're not able to draw the line? Because something moral comes in the way. And what would happen if this moral thing, then we went to the next step and there you say, no, but I am responsible for this person. Correct? So we are at this point. So where did you learn about responsibility? Who taught you about responsibility?
Picked it up from people, society, heard it everywhere.
Okay, close your eyes. Close your eyes. And as you close your eyes, Palak, just keep chanting responsibility, 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 responsibility. And from wherever you learned about responsibility. And tell me what comes to your mind, what images flash in your mind, what visuals come, what circumstances come into your mind. The first thing, without thinking, no analysis, the moment you latch onto that, you can keep your eyes closed or open and you can start talking to me.
My ma'am.
Your ma'am? Okay. Okay.
That's where I learned about responsibility. She was the first person I trusted and, felt close to, felt safe with.
Excellent. So think of that ma'am now. Think of that ma'am. Okay. And as you think of that ma'am, just look in her eyes. Just imagine. It's okay to imagine, even if you can't see her. Because visualization is something that everybody can't do, but imagination everybody can do. No issues. Think of that ma'am and just look in her eyes and tell her, I love you and I trust you. Say it loudly.
I love you. And I
And I
trust.
trust you. And that's why I picked up your beliefs about responsibility.
And that's why I picked up your beliefs about responsibility.
But now they're not serving me.
But now they're not serving me.
I wish to return it back to you.
I wish to return it back to you.
And just look into her eyes. Imagine as you're looking in her eyes, what is she trying to tell you?
She's smiling.
Yeah. So it's okay. Try to see beyond the smile. What is she trying to tell you? As if by thought transfer, she will tell you. What is she trying to tell you?
It's deeper than that.
Yeah.
It wasn't just her. She's telling me that it wasn't just her that gave me this belief system.
Okay. So tell her, can you please tell me and identify from where else I picked up this responsibility issue? Take her help. She's your support system. She's your guide. Okay. So 1, 2, and 3. Let's go back. Where else are you
The
picking up
person,
the responsibility thing from?
the person that I feel responsible for, that person telling me that.
Okay. Okay, brilliant. Bring that person there. Imagine that person. Look into the eyes and let your ma'am also be there with you. Okay. And as you're looking into the person's eyes and tell this person that, you know what, I'm taking your responsibility on me. Tell him loudly.
I'm taking your responsibility on me.
And I'm really ruining my health because of that.
And I'm really ruining my health because of that.
I'm going through compassion fatigue now.
And I'm going through compassion fatigue now.
Now look in his eyes. What do you see? Don't think, yeah? Just connect to the eyes.
It's really sad. The eyes are extremely sad and watery and telling me, but you're all I have. And
Okay.
be there, then who will be?
Okay. So tell him, I recognize your sadness. Tell him loudly.
Nice your sadness.
And I know you want me to carry you along everywhere.
And I know you want me to carry you along everywhere.
But now I'm breaking down.
But now I'm breaking down
By carrying your responsibility.
by carrying your responsibility.
Look in his eyes. What do you see?
More than the person, I can feel acceptance in myself.
No, it's okay. You see in the person's eyes. Just stop thinking, no, for a moment. Just let your conscious mind go on a holiday. It's okay. Yeah? We'll work with the feelings.
Okay.
Because cognitively, if you would have been doing it, by now it should have been sorted. It's not done. So let's do it the non-cognitive way. Okay?
All right.
So just chill. Just look into his eyes and tell him, I'm tired of carrying your responsibility.
I'm tired of carrying the responsibility.
What do you see in his eyes? Just connect. What do you see? First thought. As you connect, you'll know the thought.
Breakdown.
Yeah. You see breakdown in him. And what does that make you feel?
I find myself breaking down as well.
I'm breaking down as well. So his breakdown is my breakdown. Yeah. True. Look at your ma'am. What is she saying?
She's asking me to accept myself and do the right thing by me.
Yeah, okay. So what does that mean? Ask her, what does that mean? Don't try to understand it, okay? Just ask her.
Move on.
Move on. Yeah. So, Palak, what does that mean, move on?
I guess it means that I cognitively or emotionally.
Whichever way you want.
I guess it means that I need to accept that I am not responsible.
You believe that?
Partially, but getting there. I think I do believe it, I just don't want to accept it.
So now look into his eyes and tell him deep down, I don't want to take your responsibility, but I'm not able to help myself.
It's hard. It's hard to.
Yeah. Okay. Fine. So what did you learn from this whole exercise?
Can I open my eyes? I'm still
Yes,
in
of course.
What did I learn from this exercise? I learned where the lines are blurred. The last thing that I said about what you said about telling her that I somewhere inside believe that I don't want to take responsible. I'm not responsible, but I don't want to accept that.
Okay, cool. That's it. So what's your learning? What is the cause of your compassion fatigue syndrome? One line.
I think I'm missing something.
No. Wait now. What, according to the process that we did, do you think is the cause of your compassion fatigue syndrome?
Not having acceptance.
Just be here in this process only. Don't go around fishing for
Not
causes.
having acceptance.
Okay, is that what you learned from the session? When you try to analyze it, no, this is what will happen. Don't analyze it. Just be with the process. You saw him, you saw your ma'am, you saw the dialogue that happened between the three of you. What do you think is the cause of your problem? And you know that if this goes away, my problem will go away. What is that?
I still think it's acceptance. I just need to accept I'm not responsible.
That's it. Correct. Again, don't give the word acceptance because that never came up. That is your word. The simple thing what came up in the therapy was what? That I know I'm not supposed to take his responsibility, but I'm not able to not do it. That's it. Keep it simple. Keep it simple. You have realized that you're carrying unnecessary responsibility of somebody else, which is not permitted. It is not kindness to another person when you carry their responsibility, because you're making them imbecile, invalid, handicapped for the rest of their life. They will never take responsibility because you are carrying it for them. It's human nature. When somebody else carries my burden, I don't carry my burden. So that's it. Awareness is enough. This is an awareness exercise for you. This is where now your therapy work will begin. Why is it that you need to carry other people's responsibility? And now that's where the real story starts. Okay, so Palak, just be with this for a moment. Okay, guys, all of you, unmute yourself. Let's try to understand this process. This is lots of work we have done. And in short 20-25 minutes, if you saw, it's lots of work. This is going to put her in a now thinking spree, because there is no reverse gear in this understanding. Once you become aware of your issues, there's no reverse gear, and that's why ignorance is a bliss. Don't go into awareness tip and therapy work unless you're really mentally ready to change. So it's like one teacher used to say, don't ask me a question if you're not going to accept my answer. Don't ask me. And if you're asking me a question, you better be ready to accept my answer. Otherwise, don't come to me, search for your own answers. Make sense?
So in
So,
a way, you can say like let things happen the way that it's happening. Ignorance is a bliss when you said. So I feel like let things happen when you're not aware only. So like actually, the previous years of my life, how it went. Suddenly, if I face problem, then I say, okay, that time I should have spoken. That time I should have behaved. So actually, it was an ignorance. How you said, ignorance is a bliss. So right now, also, no need to bring awareness. Let this also go as it is. Is it?
so if you're happy being ignorant, it's fine. But then that is not an excuse for not becoming aware. If you're using that as an excuse,
No.
then it becomes an escape mechanism. So ignorance is a bliss, and if it works for you, let it work for you. See, we only take the car to the garage when it is not working. You don't take a normal car to the garage. So if ignorance is a bliss and it's working for you, you are healthy, happy, fit and fine, it's okay, enjoy it. Who's telling you to become very enlightened? Okay, but here it was bothering Palak. She's come for a therapy on an
But
open platform. It's not working for her, and she wants to know why. And now she's come to know why. Now I know the leakage is coming from the pipe in the next room onto my bedroom wall, and I'm keeping on plastering my wall and painting it again and again. But every rain, the leakage comes again. But I know the leakage is in the next room, but I don't want to change that pipe. So then live with the wet wall, be okay with the fungal infections, be okay with the cost that you're paying every year after monsoon of plastering and repainting. Keep doing. That's okay. It's your choice. Nobody can force you to be happy.
if it's not bothering me, but you see, it is bothering somebody else, someone close,
Mm.
then it starts affecting you.
So, okay, very simple, Geeta. I don't know whether you are in therapy work, but we work with people who come to us with a problem. People who do not come to us with a problem, we cannot do anything about it. So somebody else is suffering and they're seeking help, we will work with them. But if they are not wanting to seek help, we can't do anything about it. Some people choose to suffer and we need to honor their journey. It's okay. You have to honor their journey and their destiny that they are choosing. People who are willing to change, yes, we have some tools we can offer them so they can help themselves. Yeah, because again, I don't want to carry the burden of healing the whole world. I don't want to do it.
I wanted to
I will
say
try to
So
help
just
people who want to be helped.
so one thing I can say, like I catch certain important points and adapt in my life and have a good experience, like how Atul sir had told me when I was mentioning about some problem. So he said, okay, shut all everything and just make yourself strong. So I have held that point and now I'm just working on it.
So good, very good. Very
I
good.
feel okay, if I make myself strong, the other person also it's maybe it's affecting less now.
So very good. See, ideally, everybody else is our reflection. So rather than working and working on others and changing the whole world, it is very easy to change myself. And when I change, see, remember, this is a great universal truth. Maybe you can use it. I say it almost in every class of mine. And I saw this in the book, The Power of Now by Dr. Eckhart Tolle.
Eckhart Tolle.
He says that and which he also picked it up from Osho, and Osho also picked it up from some mythology, is that if you see a mirror and you don't like the image in it, by changing the mirror, coloring the mirror,
अंघोळीला
or
गेलाय.
doing anything to the mirror, the image is not going to change. And if I want to change the image in the mirror, the only way is to change myself. Only then it will change. So the other person who's suffering because of you, or the third person, there's no point working on them. Work on yourself, which you are doing. As Dr. Atul has rightly told you, work on yourself. When you work on yourself, the subconscious triggers that you give to another person, they stop. So the other person stops behaving in that way automatically. I have so many daughter-in-laws, they come and tell me, Doc, I'm working on myself. Why is my mother-in-law changing? Now, she says, this is so funny. I'm working on myself. Why is my mother-in-law changing? Because now you imagine, let's say, subconsciously, whenever you pass your mother-in-law and you feel, you bitch, but you're doing namaste, you bitch. In your mind, you're saying, you bitch, okay? Now, subconsciously, she is getting that so-called chutki. So she reacts. The moment you are healing in yourself, and maybe somebody has told you, let's say Ishita Ma, some Guruji, yeah, or Shruti Ma from Pune has called you for pravachan, and she tells you everybody is your reflection. Okay, so now what happens every time you go to your mother and you feel, no, yeah, she's just me. And you actually don't kind of subconsciously pinch her anymore. So her reaction changes. And now you believe, I have changed. I don't know why she is changing. That's because we are all interconnected.
Yeah.
Yeah, it's
Yes,
like the
totally.
butterfly effect. It's like the butterfly effect. So I don't try to change others. I work on myself. So Geeta, I'll come back to you again. There are some other people also with questions. I know you have lots of questions, but what you're doing according to Dr. Atul's theory is superb. Please continue that way. Just keep working on yourself. You know what? If we only carry our burden and responsibility, no, it's enough. One person only, एक को तो संभालो यार, बस हो गया. अपने आप को संभाल लिया ना, बहुत बड़ा आपने दया कर दिया है पूरे यूनिवर्स के ऊपर. दुनिया को छोड़ो, खुद को संभालो. And that's what we need to learn. Okay, right? Anybody else who had raised the hand here? Shruti, you are unmuted. You want to say something?
Actually, when you spoke about responsibility and morals, so so my question is, do we go back to the belief systems, the sanskaras and the associations that we have made, that we see when in our 0 to 8 years, that we see the person, doing something, even, kind of taking the brunt on self, but doing it for responsibility. So that becomes the right way to do it. Does this become the kind of primordial thing in the person's life then?
Okay, so my question to Shruti would be, Shruti, can you put all this question in one line for me?
Okay, all this question in one line. That's the most difficult part. I can go round and round.
Round jalebi everybody can do.
I swear, jalebis. I remember your jalebi so well.
Yeah, so now let's go to Ghatia,
okay,
which is straighter.
So do we go with what we have seen and we have heard all our life?
Okay, good. Yeah? Now Shruti has put the question, do we go by what we have seen and heard? Now see the beauty. Shruti, what do you think is the right thing to do?
Right thing to do is what you feel right.
Correct. Now see, did Shruti actually want the answer from me? No. So nobody can give you the answers that you want. All answers are with you only. Only we need somebody to act like a catalyst or show you the mirror without putting ideas. See, I don't want to gaslight Shruti. I don't want to give her my ideas. So what will happen? She's talking about all the morals, sanskaras, which she has learned from others. Maybe somebody whom she looks up to. Now she's asking another person whom she looks up to, me, to tell me whether I should follow or no. Then I'll say, no, don't follow that. Follow this, what I'm giving you. So actually she's coming from fire and going into the frying pan. Big deal. Ultimately, you have to follow, Shruti, what you feel is correct and what is win-win. And what your heart says can never be damaging to you or somebody else also. It has to be win-win.
Then again, another question on this particular thing. I have done this in these many years. I've tried to do this. But then there is that chota sa keeda jo dimag mein rehta hai na, of appreciation. Of receiving appreciation from people that you have done right, bacha, pat on the back and wow, you're so good. And then again, the strokes that we spoke about initially. So so my question is, how do you separate these things and know for yourself? Like you said, you need to know what is right for you feel what is right. So how do you do this separation? Is
Chal
it
chhod na,
awareness,
Shruti is a teacher. She
introspection?
conducts workshops. She's just playing with us here. Okay.
No,
She's a
Yogesh,
very
I'm
good
not.
trainer of a
No,
very
I'm not.
big level. She's a corporate trainer.
Thank you so
Shruti,
much. Yeah.
understand one thing. You like
Yeah.
appreciation?
Yes, I love it.
That's it. Be aware. I love appreciation. And I know
Okay.
I'm doing this for appreciation. That's it. Be aware and do. That's it.
Okay.
What's wrong in it, yaar? What's wrong to feel appreciated?
No,
Mind
absolutely.
learns. Let's see, you learn by appreciation. Cool. That's great.
Yeah.
Just because somebody told you that this is coming out of a void. Bullshit. ठीक है, void to void. I love appreciation. At least I know it.
Yeah. Correct.
I
True.
know chocolates are
True.
going to make my tummy come out, but I love them. And I'm eating them knowing कि मेरा weight बढ़ेगा. Cool. You're doing it in awareness. And that's
In
all right.
awareness.
That's
Okay.
all right. That's all right.
Superb.
Because
Yeah.
one day you will realize कि नहीं यार, अभी मेरे को सच्ची में पेट कम करना है. And now
Yeah.
I think I will
Yeah,
reduce
yeah.
my chocolate
Correct,
intake.
correct.
And that will come. So that's
Correct.
it. That's it. Just be
Yeah.
aware that you like appreciation and this is my way. This is my driver. This
Yeah,
is my
that's my
driver.
driver. Yes,
And
that's my
maybe you
driver.
could tell all your loved ones कि boss, I love appreciation. If you want some good work to be done by me, kindly appreciate me. झूठा ही सही, पल भर के लिए कोई तो हमें प्यार कर दे. No problem. No problem. Be aware. The idea is to be aware. Let's not fool ourselves. Because awareness is the first step to cure. Once you're aware, like Palak now has become aware that I am not able to know where to draw the line. And why am I doing that? Because I like to take responsibility of people whom I connected to. And because I'm carrying the responsibility, I'm going through compassion fatigue. Itna bhi pata chal gaya, this is a great revelation. Because ye self-acceptance aa gaya hai कि I am damaging my own self. She has come to know this and I'm very happy with that. I don't want to go further than this. Geeta Arora will say, nahi, come on, let's go further now. Fast, fast, fast. No, wait. This is a habit. This is there since years. Awareness is the first step. Then she will know herself.
Correct.
You know, I always believe in this one thing. Once the why of the problem is clear, the how of it is very easy. You don't need a guru. You don't need an institute to tell you what to do. When the why of the problem is clear, the how of it is automatically taken care of. If I know the next room pipe is leaking and causing leakage in this room, I don't need a guruji to tell me. I just need to find a plumber ke boss, wo pipe hatao. Change karo. That's it. How of it is very easy. I will Google, I will ask somebody and it will happen. But that why is the diagnosis. That diagnosis is very important. Yeah. So, yeah.
I wanted to
Jyoti,
ask.
what's going on in your mind? You look very far off. Unmute yourself.
Hello.
Yeah,
Hello.
Yeah, hi Jyoti. What's going on in your mind?
Listening to you. Similar to what these people are saying, but you know what she was right now telling, like, you know, ke wo sanskar, wo karna, you know, you go on doing it, doing it, doing it. It's just like, you know, a dormant volcano, and one day it's going to erupt. So now that's also happening with me. So I'm trying to use the power of no, you know, which was very difficult. But now I'm trying to use it, but people are not ready to accept it. You know, that change, ke, oh, she's saying no to me now, you know. So I was just thinking, ke, am I on the right?
Okay, so Jyoti, we'll take this little further. So same way like we did with Palak. So whenever you feel that I am like a volcano which is ready to burst, you know, few more things are going, last straw on the camel's back and the back will break. I can still handle a lot of more shit. It's coming, it's coming, it's coming. Abhi tak pura breakdown nahi hua hai mera. Right?
Yeah,
but
right.
I'm learning the power to say no. Chal, ye sab bullshit gyan hai. This is bullshit
पर ये मुझे पता है ये थोड़ा सा टाइम के लिए नो है. Again I'll come back to square. वही संस्कार,
There you go. There you go. There you go.
So वो maintain करना. That question was going in my mind to ask you.
Chal, cut the crap. Jyoti, you're still there. You're still in the crap. Tell me what will happen if you really say a no. What is your fear? अगर एक दिन ज्योति ने बोला सब तेल लगाने जाओ, I don't care a damn for all of you. I am going to enjoy my life. what will happen? What is that fear you
Everyone
have?
will everyone will cut off from me. No
There you
respect,
go.
no
So what is the fear?
love,
So what?
insecurity.
Wait.
Insecure.
Respect, love, or
Yeah.
insecurity? What is your need?
कईयों से respect है, कईयों से insecurity है.
नहीं, तीनों में से क्या चीज जरूरी है? Suppose you're going to die tomorrow morning. What is that one thing you need tonight?
Love.
There you go. So what is the fear you have? That if I say no, I'll not be loved. Bas.
Bas.
Now you do
Yeah.
what Palak did just now. Just do exactly that. Close your eyes.
Yeah.
Who told you this belief? Okay, you know what, Jyoti? If you say no to anybody, nobody will love you. And to be loved, you should please everybody.
Yeah.
Somebody came to your mind. Yeah, got it? So now you do that process on your own for some time. वो जिसका है कचरा उसको दे दो. डॉक्टर गीता पंजाबी ने बोला ना, ये कचरा जिसका है उसको वापस दे दो. ठीक है? Now it's not working for you. And then understand, do I need this belief anymore? Yes, it worked for me that time. It is nice. And normally we pick it up because we love that person. Okay?
Yeah.
So just do that. Just do that.
So Palak has had an awareness.
Okay, Palak, I think she wrote something in the chat, right? Yeah, Ishita, please come on.
Can I read it out?
Yes, please.
Okay, so Palak has written, I'd like to add a small thing. It hit a few seconds after a few moments of the process. I became aware of a belief system that was leading to compassion fatigue. I believe the person to be incapable of taking responsibility and resented the person for not taking on the responsibility.
Yeah, actually ना ये psychologist लोगों के word मेरे को थोड़ा difficult लगते हैं समझने में. Can you please explain? I didn't understand.
Palak, you're still there. Please explain, and we will start wrapping up.
Right. This is the thing, right? This is awareness is something. This process always helped me understand awareness. Last time sir had done this with me, and I had a different awareness about the belief system that I held about being alone and being with people. So what I realized is that somewhere in the beginning, even before the process began, I did mention that I feel that the person has crossed the line to be saved from. So I just didn't realize that that was playing a role in me resenting and, coming up with this fatigue, because in a lot of ways, I didn't realize that I hold that person responsible for not taking their own responsibility. And that's why I felt the need to take up responsibility, whereas all the while I did not believe that the person is capable of taking responsibility, because there is a clear clash between the two belief system. I kept falling in a loop of the compassion fatigue. And this.
Wow, very good. Palak, now tell this in one line.
Okay.
Tell this in one line. What is the awareness you got?
The awareness I got was that my two belief systems were clashing and leading to compassion fatigue.
Which were the two belief systems?
One was that the person was incapable of taking responsibility of their own emotion.
Correct.
The other was that the person held me responsible for taking responsibility of it.
Okay. So now with this awareness, what is your next action?
I work on it. I'll it's
work on it doesn't work. You have to be aware now.
And
so what have you learned? What have you learned from this awareness? Otherwise, this is meaningless awareness. If it does not propel you into action, it is useless.
So no, this awareness actually led to a lot of thoughts around it. For example.
Okay, so when it led to all those lots of thoughts, what did it lead to that after that? What would you do after that?
I plan on now I get your question. I'm going to try and end this belief system and change it, create a better belief system around it.
Give me something more tangible and something more which I can believe.
Okay, so like a belief system.
No, I don't want belief system. That is Shruti's domain.
Something more tangible. I know, I just realized that I do this with a lot of people. It's not just...
There you go. So what you need to do to be out of this compassion fatigue syndrome? My question still remains.
Hold people responsible for their own self.
That's it. Palak, you got it.
Thank you. It wasn't possible without.
Whew. So, okay, now who's going to explain what Palak learned? Sushmita.
Sushmita has joined us from Bangalore.
Okay, Sushmita, hi. Thank you so much.
Hi.
Sushmita, what did you learn from Palak's awareness?
I think
One line.
Okay. You don't have to burden. I mean, I need not burden myself with every emotions that I go through because of other people.
Excellent.
And
Excellent,
I need
Sushmita.
to, yeah.
Excellent.
And I need to hold themselves responsible for
No,
whatever.
now don't talk. Then it will become story. You got it in one line.
Okay. Yeah.
Best is when you get the essence, no, stop it there only. That's why these one-liners you have seen, they make so much impact on us, no? So what Sushmita said is beautiful. She said, I don't need to burden myself with other people's emotion. So what she's talking about is the classical concept of psychology, the difference between empathy and sympathy.
Yeah.
Everybody knows it now. See, everybody here knew it. But when are you going to apply it? So what is empathy and sympathy? Dr. Geeta Punjabi knows the pain of the patient. But she doesn't start crying with the patient story. कि अरे तेको बहुत दुख हो रहा है, कम मेरे कंधे पे आके रो, मैं भी रोती हूँ, दोनों बहन अपन दोनों रोएंगे, दुख मनाएंगे. It doesn't happen. She'll say, okay, fine, I understand your sadness. Let's do something about it. And I understand your pain. But I'm not going to go through your pain. So I understand that you cannot take responsibility. Maybe I can help you take your own responsibility. Maybe I can guide you to professional help if you want. But I am not your donkey who's going to carry your weight, because my back will break. And that is honoring myself. Even if you have a fear like Jyoti Kapoor. Jyoti will say, if I say no, everybody will leave me and go away. Nobody is going to love me. I'm going to be all alone in this world. Oh my God, what will happen? Yeah, that's the cost you have to pay of facing your fears. And then you have to work on your fear. Because fear is FEAR, false evidence appearing real. Research says more than 90% of your fears never come to fruition. And we actually make our lives miserable. Jyoti, Dr. Geeta Punjabi is here. Dr. Geeta Punjabi, who lives in your house? Can you please unmute yourself? Now, this is an inspiring story. Yeah? Dr. Geeta Punjabi, please unmute. What is your age, ma'am?
80.
80. What do you do? आपकी day की activity, please आप बताएंगे ज्योति को?
हाँ, सुबह को सत्संग सुनती हूँ.
हाँ.
Then go for bath and have nasta. But आजकल क्या है? After the operation, I feel very drowsy.
हाँ.
I got cancer, no? I don't know whether you know it.
No, I don't know.
The radical mastectomy is done.
Acha, okay. Then
drowsiness आती है. Then I rest for 2 to 4 hours. Then 5 to 7 is my study time. I still work.
She does an active practice, okay? She's a doctor.
No. I practice. I have stopped totally.
Stop कर दिया कभी?
कभी से बंद कर दिया.
कितना time हो गया?
1 साल समझो, थोड़े हैं.
हाँ, 1 साल. So what was that age at which she stopped practice?
79.
अभी आपके
79.
So till 79 years, Jyoti, she's working and she stays alone.
And
practicing, staying alone, everything managing on her own.
Nowadays I feel if God has given me cancer, He wants me to do something. So I'm working on cancer now. To learn prophylactic of cancer.
There you go. I'm sure if you see her work and her books, many books can be written on the original research work she has done. Till I think a few years or 1 or 2 years back, she was going to Lonavala every 10-15 days and working in that some institute, running charitable clinic there also, and she's doing up and down. She used to drive a scooter even now, sometime back.
Till today.
Till today. Scooter pe sign jati satsang sunne. Now, what are you talking about fear of being alone? Look at her.
Yeah.
Yeah.
Thank you.
So that's the inspiration you have. That's
If
the
anybody
inspiration.
asks me, you're alone, I tell them, one who says I'm alone is a liar, because he is within you.
Ah.
Yeah. Thank you, Dr. Geeta Punjabi. Thank you so much. Yeah.
All
Thank
right,
you.
So
we'll take
Remembering
one.
so
Thank
much.
you. Thank you.
Thank you so much, ma'am. It's an honor.
thank you. Yeah.
So
So
we'll take
understand this
one
fear
quick.
of being alone. Sorry, Ishita, can I just 1 minute just
Sure,
finish
sure.
this? We'll just wrap this up. So remember, human beings are, if you see anthroposophical studies, human beings usually are solitary by nature. But we have this fear of loneliness, fear of not being loved, fear of being alone, is because of our social interactions and attachments that we develop. And that's why spirituality teaches you detachment. Otherwise, if you see, everybody wants their space, everybody wants to be left alone. Only when we have a need, an ego-based need, that we get attached to others, and then we get into relationships, which actually we call relationships, but it's actually need-based. If all your needs are met and you're told that you'll be taken care of till your last breath, believe me, you will want to live alone. Yeah. So in fact, they did a study. There was a great study done worldwide. Why do people have fear of death? And you know what? The reason that came up was amazing. Why do people have fear of death is because they feel we don't know that after we die, will we be alone there or there'll be somebody. So that's why when people die, they are told, while they're going, they're told, see, all your ancestors are coming to take you from there. Your loved ones are coming to take you to the other side. So this is told to calm themselves. It is the fear that I'm going to be alone there. It is not the fear of death that they have. It is the fear of being alone there once again. So Jyoti, does that make sense? It's an
Yes, yes.
existential fear. It's an existential fear we all have because of the years of upbringing of not being able to be left alone. A girl in India who's brought up is scared to travel from here to northern India alone. But a girl who's brought up in Germany and America takes a backpack at 17 years of age, though she's very pretty, and she comes and goes on a backpack trip all over India without any fear. She takes care of
Yeah.
herself because she's trained. But we find it little difficult to go, isn't it? So
Thank
understand,
you.
it's our upbringing. It makes sense to
Yes.
you?
Yes,
Yeah,
yes,
Ishita,
yes.
over to you, Ishita.
Yeah.
Thank
So
you.
we have kind of crossed the time as well. It's almost an hour and a half, Yogesh.
Yeah.
But there are two questions. If you, I think Dr. Shreya, is that Dr. Shreya? And Kavita has had her hand up for a
Yes.
while.
Yeah,
So if you
okay.
can make it a little quick so we can just wrap it up in the next 5 minutes, it would be great.
Okay.
So who's going first? Is it me or is it Kavita?
Yeah, Kavita, can you go first? I think you were on.
Okay.
Yeah. So I always have a lot of questions for Dr. Yogesh. I just have one small question. After the solution or the case we discussed of Palak, how do you feel? How do you get over with the guilt of not feeling guilty? Now that I've understood that I am not responsible for how the other person is feeling or responding, or how I've chosen to respond the way I want to feel about it. But then, there are people, especially most of the times it's your loved ones, people that you care for most, who try to make you feel guilty. And then somehow, I think I'm on a path where I now feel guilty of not feeling guilty. That, okay, fine, they're trying to make me feel a certain way, but I don't feel it. Am I okay? Am I like, have I become like too cold-hearted? Or
Wow.
I hope you're getting what I'm trying to say.
Absolutely. Absolutely. It's an amazing thing that you have brought it up here, Kavita. Thank you so much. So what Kavita is saying is that is it okay if I do not feel guilty where I'm supposed to feel guilty? Okay. So have I gone into an indifferent state? Have I become cold? Have I become a stone? And is it normal to not be so, sensitive anymore? So again, Kavita, You have to ask the same question, because this is the whole process that I want you all to learn today and do. So I'm just going to say it in the same way, so it becomes like a revision for you. So ask yourself, are you happy by not being guilty? One.
Yogesh?
Yeah.
Yeah, I think we lost you there.
Oh,
Yeah,
we
we
lost
lost your
her.
audio last. No, I mean, I just missed last 10 seconds of what you said.
Okay, so are you happy not feeling guilty? Yes or no?
Yes.
Yeah, so then that's not a problem. So all rest is all guilt that you have, that I'm not guilty, feeling any guilty. Okay, so what you have to say is, as long as I am happy, it's fine. Okay,
Yeah,
so
yeah.
don't bother about it. Whatever feels right, as Shruti told you the little while ago, if it feels right and good to you, and if you feel that, you know, it's making me feel good and light inside, and that it's a win-win for me as well as for people around, yes, it's good enough. So don't need to ask anybody. It's your own yardstick that you're going to measure. So first of all is, let's quickly go to the next question. Before that, we'll just quickly understand what we did with Palak, with Jyoti, and we spoke to others. Is the moment you have an issue, compassion fatigue, or any other issue, ask yourself, what is it that needs to change in me so that this problem will go away? You get the question? What is it that needs to change in me so that this problem goes away tomorrow morning? Make it even more specific. And it's a tough question to answer. Something very, very deep will just surface up. Yeah, and it will make you aware. So let's say I want to reduce weight tomorrow morning. Okay, so what needs to change in me so that I start reducing my weight from tomorrow morning? Something will come to you. Okay, so coming to the next question. Ishita, who's the next person who wants a question?
I think Dr. Shreya, and then we
Yeah,
can wrap
Dr.
up.
Shreya.
Yeah. Hello. So more than a question, I wanted to answer this new question. If you were asking what is your takeaway from the session, I'd like to respond to that. From today's session, what I got is that, as homeopaths, as psychologists, we have such a sound understanding of the human mind and behavior that you tend to understand everyone around you, whether it's your parents, whether it's your siblings, your friends, your husband, your mother.
Sorry, I lost you. I'm not able to understand you.
Neither am
Hello,
I.
can you hear me now?
Yeah, can you hold your mic closer to your mouth and go little slow? Yeah.
Yeah, am I audible now?
Yes.
Yeah, so I was saying, I just like to share something about my takeaway from the session. While we were doing the demo, what resonated with me was this, that why I am going through compassion fatigue is that as homeopaths and as psychologists, we have such a sound understanding of the human mind and behavior that we tend to understand why everyone is doing what they are doing in our lives. So we tend to give benefit of doubt to our parents, to our siblings, to our mother-in-law, husband, friends, patients, everyone. You know why they're doing what they're doing. So in understanding everybody, what happens is you start neglecting your own feelings. Like, yes, I understand where they are coming from, but that does not change how I feel about this. So that is something that changed
Yeah,
for me.
thank you. Thank you, Shreya. You wanted to share this. It's not a question. Okay, thank you. That's
Yeah,
very nice. So what Shreya said, I'll quickly tell
thank
you
you. Yeah,
in a nutshell. What
yeah,
she's saying is, when you're a psychologist or you're a mind worker or you're a homeopath, because we deal a lot with mind. I'm a homeopath, so I know. And, we tend to understand everybody's minds so much. And we give everybody else a benefit of doubt except ourselves. So that's what I think Shreya is trying to say. Excellent.
yes,
So very good, Shreya. That was nice sharing. So again, very simple. When I have compassion fatigue syndrome, what do? Is I need to find out, first of all, what is it that needs to change in me tomorrow itself so that I do not suffer from compassion fatigue. Something will come to your mind. Some idea, some belief system, some value system will come to your mind. The moment it comes to your mind, next question you got to ask is, okay, where did I learn this? Who gave me this belief? Because it's all a learned behavior after all. So either mostly one of your parent will come, or a teacher will come, or somebody whom you look up to, or maybe it's a movie, maybe it's a good book you learn from, or it's a role model that you learn from. Somebody will come. All you have to do is give that back to them. And when you're doing this, it's like a projection technique. The psychologists here will understand what we did with Palak. It was a projection technique. We just brought in that person whom she likes, who's, for whom she's carrying the burden, taking the responsibility of that person. We brought in the ma'am with whom the belief was there. And that's it. We returned and we just allowed her to project her thoughts on them. Okay, what are they feeling? What are they trying to tell me? It's like you're putting them into the role play or in their shoes. And the moment they do that, they suddenly understand the other person's point of view. And Palak herself got her revelation. And once that comes in, you have kind of discovered, you have removed the cover. Discovery is removing the cover. So what was nicely covered, you now discovered, and your real self and the vulnerability comes up. Your vulnerability. And there the vulnerability of Jyoti Kapoor came up and she said, shit, I will not be loved. And like, that's a great feeling. Meaning, it's a very authentic feeling. You become very honest. All the smile will go away. The tear will come. And you'll say, shit, man, yeah, this is too much. What do I do? But at least now the why of the problem has come to it. Now Jyoti will find out what to do. Palak will now find out, why am I carrying the responsibility of others? Or maybe Palak will then realize, why am I attracting people who want me to carry their responsibilities? Is it a pattern? Is it a pattern? Am I the donkey who keeps going to people and saying, please put your burden on me? And suddenly that revelation comes. And once that awareness comes, you know the why of the problem. And believe me, most of your symptoms will start reducing. And then you will, and when that's when they say, when the student is ready, the teacher arrives. You will find someone who will tell you how to do it. Either it's a Google, a book, or a movie, or a friend, or a chance meeting with somebody will come into your life, and you will find a way. As Yadu Krishnamurti would say, the door will open for you. But for that, be aware, the judge has to know who has written that order. And you have to be, as so beautifully said by Palak, in acceptance that I have this fear. I am doing this. That's it. It's only I, me, and myself. No more blaming others for it. Oh, he will break down. Oh, he needs me. Oh, what will he do? I won't be able to see him ruin his life. Then you're not honoring their fate and destiny. You're not allowing them to grow. And even if you speak karmically, you're picking on the karma of somebody else. Why? Yes, you can offer love, you can offer assistance, but you got to draw a line. Once, twice, thrice. Okay, I don't think I want to do it anymore because it's now affecting me. So when you're in an airplane, the first instruction is, in case of an emergency, oxygen mask has to be put by whom first?
You.
Yourself, then your child. And they did this interesting experiment where a monkey and her baby was there, and they put them in a drum and they started putting water. And initially, as the water was rising, the mother picked up the baby up higher. But when the water reached the nose of the mother put the baby down and stood on top of the baby. Of course, we don't need to go to those extremes. But what I'm trying to say is that you are divine and you got to take care of yourself first. Only a happy person can give happiness. Unhappy person can't give anything. An empty cup cannot give anybody anything. So start working on yourself and just ask these questions. They're quite amazing and it's an onward journey. Just be with yourself. If required, take help of somebody. I think this group is good. You can take help of somebody here as well. So with that, I hope this helps you. They're very simple questions. I think Ishita has already typed it on the chat for you. Just two or three questions. Yeah. Yeah. So very simple, where does it come from? Catch that, give it back to that person. And what needs to change in me tomorrow morning so that this problem is not there? And then you have to take action, because it's not only about wisdom. Wisdom with Purusharth is important. And Purusharth is the effort. You have to then start walking that path. Yes, initially you'll be scared. So thank you
so
very much.
Thank you so much, Dr. Yogesh. It's
Thank you.
it's been a wonderful session, and I don't know how time has flown like I don't know what, and it's always precious to kind of hear from you. Thank you for taking time out for all of us, and thank you everyone for coming on board. And I will be ending the recording here. And I will be able to provide a YouTube link by tomorrow because I'll need some time to edit and all of that.
I don't know what I'm supposed to do. What is
Can I request something, Ishita? Can we
Yes.
not put this on YouTube? Because see, Palak's therapy work has been done.
Right.
And I don't think it would be a great idea. I think we
Alright.
can share it amongst this group which is here.
Sure,
But
I'll do it. I won't
otherwise,
put it on.
I don't even think we need to share this, very frankly.
Okay.
It's just 2 questions because, you know, we should honor somebody who opened up.
Yeah.
And she is a person who's treating people, patients, clients, you know, she has a foundation of her own. It's not a good idea to have this kind of sensitive material on a public platform. This is my belief. I don't know what the group says. I have no issues putting it.
I agree. I agree with you.
I just want to be a little sensitive to Palak as well as other stories, you know. This is really, really sensitive material. And
but I'll edit it and share it with you. You can share with whoever attended the session in that way.
In case you want it, otherwise I think the essence is gone to everybody. Palak, what do you say?
So personally, I think I've come to a point where I'm quite open to having this out there because I believe that, in fact, this is another stigma. As therapists, it's like, we have it all figured out. It's always that thought that's out there. So in a way, it's a good thought to be put out there that we ourselves are going through vulnerable process all the time, and that, we are also dealing with it. We are also just learning.
Wow.
So in that sense, I'm pretty okay with it. And
okay, so Palak, I must congratulate you. You are a very courageous girl, and thank you so much, Ishita. So then it goes public.
It goes public.
Thank you, Palak.
Yeah, because she has given us the permission, and very few people can do this where a person can openly say I'm vulnerable. And believe me, in this vulnerability lies your strength. In this vulnerability lies your strength. Because when I am vulnerable and I open myself up, I will attract all the help that is needed. But when I show I'm very strong, then nobody wants to help me because you're already strong. And you're putting a mask of strength and showing I'm very strong. So then nobody wants to help. But the moment you say I'm vulnerable, the natural human response is to help. And that's how you overcome. And who knows, your vulnerability may be your biggest strength. Amitabh's voice was considered vulnerability, but it became the USP. Rani Mukherjee's voice was considered the vulnerability. It became a USP. So maybe that becomes your strength. Yeah, you discover something more.
All right. Thank you so much, everyone. I'm ending the meeting. Thank you. God bless.
Thank you. Thank you, Yogesh. Thank you, Ishita.
Thank you.